guys, welcome to our Facebook Live. I'm Julie, the digital beauty editor for NewBeauty magazine, and we are here with facial plastic surgeon Dr. White, as well as our wonderful model slash patient here, Sarah. And we are going to demonstrate a super cool treatment called Ultherapy today. It's for skin tightening. But before we even demonstrate that at all, Dr. White, please tell us exactly what that is.
So Ultherapy is a great treatment. It's really a big part of my practice, and it's really for anybody who wants a little lift. And so it's for a wide variety of patients, and it's really cool because it's based on ultrasound. And ultrasound technology, we know, has been used to image the mother's womb and everything, and so it's very safe. And so how this treatment differs from a lot of other devices on the market is two really cool things. And the first is it's with ultrasound visualization, so we can see before we treat, and so it makes it really safe, and we can look at the face and see what's going on. And the second thing is that we can actually get down to the facelift layer, and we really have never been able to do that before.
Wow.
And so it's really good for lifting and really the connective tissue layer that when I do a surgical facelift, that's the layer that I re-support. And so Ultherapy is really a breakthrough device. Yeah.
Amazing.
Yeah.
And now I know that you have a super in-depth, relationship with the whole treatment.
Yes,
so can you tell me a little bit about your background and how it connects?
Yeah, it's kind of been my baby. And so I trained in facial plastic surgery.
Okay.
And so when I was a geeky little resident, I had the opportunity to train in Boston at Harvard. And so part of our requirements is to do a research thesis. And at the time, I was learning all these cool new techniques, how to do a surgical facelift, and I thought, wouldn't it be great if we had a non-invasive way to really tighten that layer? And so my research project was based on Ultherapy, and me, along with another great team of scientists, published the first paper in the medical literature and also have a patent on it. And so I was really privileged to work with Ultherapy and see this device come to fruition, and now it's used all over the world.
Amazing.
Yeah.
Now, Sarah, tell us exactly why you want to get Ultherapy in the first place.
So I want to have Ultherapy because I just started to notice the sagging skin, and quite truthfully, I looked at a picture of myself and I thought, I am turning into my mother. I saw the future, and so I just want to kind of take that back a little bit and just tighten things up, and just kind of create that firmer look in my skin, and also as a preventive measure too, right? To kind of just slow that process down. So really the definement, and I'm really helping to tighten my skin.
And then what makes Sarah a good patient for this?
Well, first of all, I think you should thank Mom because you've got amazing bone structure.
I'll pass this message on to her only.
So I think she's a really great candidate. She obviously is very healthy. She takes good care of herself. She's thin. I can see by the quality of her skin and everything, she eats well and takes good care of herself. And so she just, like a lot of our patients, are just starting to notice a little bit of changes in the mirror. And of course, social media that we're on today is the worst culprit. And so everybody's on social media now, and they sort of start to notice early changes related to a little bit of laxity on the face, and Ultherapy is great for that.
Amazing. So you're in the right hands, obviously.
Yes, can't wait. And when do I start to see results, right? So when will I see a change in my skin?
There's two parts to that, and I think one of the things that I hear from my patients that's really cool, and I didn't even think about, was that patients start commenting early on about how they feel. I have a heavy neck myself, and so I can sort of empathize with them, and so, sometimes I feel it, and you can feel that heaviness sometimes, and that's one of the earliest things that we see after an Ultherapy treatment. Patients really comment that, gosh, Dr. White, my neck and face really feel a lot tighter. It feels better to me. I really think we're doing something. And so usually that occurs at about the 1 month point.
Okay.
And then we really rely on the patient's wound healing mechanisms to build new collagen and also elastin kind of thing, because that's how the wound healing process really happens. And so usually at the 3 month point to 6 month point, that's really when we start to see really great before and after photos, really defining the jawline and also the face.
Amazing.
Yeah.
All right, well, we'll let you get right into it. Show us exactly how a consult would start and then how you would jump right into the demonstration.
Sure. So we have a nice room here, and we typically, I like to ask the patients always, what's bothering them the most, because we don't want to miss that. And Sarah commented on that. She sort of gave us a hint, and so we can definitely focus on that. But we have a nice mirror here, and I'll have Sarah look in the mirror, and maybe Sarah, you'll have you turn your head a little bit. And I have this really cool way of sort of deciding or helping patients determine whether or not they're a good candidate. And we just call it the pinch test. In a lot of the early clinical studies, they showed that we were able to tighten about 1 centimeter with the Ulthera treatment. And so what I'll do is just pinch a little bit of skin here. And in doing that, if we just pinch a little centimeter, what we're seeing is Sarah's jawline really picks up, really is more defined, and also helps her lower face. So we just do the little pinch test. And I think that's a good way of seeing, would you like the result kind of thing. So I think you're a great candidate. And, aging is not just the skin, it goes all the way through, and so you do have amazing bone structure, and I think you're a really good candidate for it.
Amazing. All right, well, let's jump right into it.
Okay, great. If it's okay with you, what we'll do is lean back the chair a little bit.
And again, for those of you who are just tuning in, I'm Julie, the digital beauty editor for New Beauty magazine, and we are here with Dr. White in New York. And we are about to demonstrate a super cool procedure. It's called Ultherapy. It's skin tightening, so it'll just take away those jowls a little bit. And we're going to get started.
Sure. So I'm just going to put some really nice gloves on.
And we didn't mention this earlier, but you have felt Ultherapy before.
Yes, so I had a treatment about 8 years ago with Ultherapy, and I felt like it really hurt when I originally had it done. Does it have the same pain tolerance, or has the technology evolved over the years to have different results, different pain tolerances?
I have to give Ultherapy as a company really a lot of credit, and MERS has really worked hard on developing a new treatment regimen called the Amplify technique. And so Amplify is a new sort of treatment protocol where essentially we dial back the energy a little bit but deliver more treatment lines. And what we find is it's definitely a lot more tolerable, and also it gives a better result because it produces more of a volumetric effect. In other words, we're delivering more energy per unit volume of the treatment area, and so it's really helpful. There's a couple of little tricks that I can do too during the treatment, and I'll show you a little bit. Hopefully there's some providers watching as well as patients today, and we can talk a little bit about that.
So everyone can learn from this today.
Yeah.
And so this is a gel that you put on just to make it run smoother on the skin?
Yeah, just like ultrasound imaging, we use a little gel that helps to couple the treatment device to the soft tissue, and so that's very, very helpful. So I'm just going to get the machine ready here. And the new interface with Ultherapy is really great too. What we can do is actually image the tissue, and we can select an area on the screen that we're going to treat. It automatically gives us recommendations, how many lines to deliver on average to that area. And I'm going to have to turn this way, Sarah, a little bit. And so usually we mark out the face, but I've been doing this, a lot of times, and so I'm pretty good at it, and so we don't have to do that. But what we do is select the area, and one of the things I like to do to help minimize discomfort with it, the treatment protocols are drawn such that about 40 lines are delivered in this area. And instead of delivering the treatment lines right on top of each other, what we like to do is skip around a little bit. And so in that little treatment protocol, we jump around, and it helps to allow the heat to diffuse a little bit, and so patients don't experience quite as much discomfort. And so you'll see me doing that. The other technique that I like to do is just the pinch technique again. And so a lot of our sensory nerves run right close to our facial skeleton. And so if we sort of lift the tissues away, it sort of helps with discomfort quite a bit. And so we'll do that a little bit. And in treating the face also, I'm going to turn this off for a second. What we like to do is, and I'm going to put on the deeper transducer, we treat deeper and then we go more superficial. And so the 4.5 transducer is the actual transducer that goes down to the facelift layer. And so we'll treat deeply, and then we'll work our way back up to the skin. And so, so we'll get started here.
And how long do results typically last?
You know, I usually recommend that, you know, it's a non-invasive treatment, has very little downtime, but it also is a treatment that you have to do and maintain. And so I usually recommend that patients come back in every year or two for a booster treatment. You never really lose the effect because as we age, we have changes in a loss in the structure of our collagen and also a stretching out of the elastin. That's why things get saggy a little bit. So every treatment we do, we're making brand new collagen molecules. And so we talk about banking collagen. So every treatment is helpful kind of thing. What happens is we can't really stop Father Time, unfortunately. So we don't really use we don't really lose the collagen that we make, but we'll continue to go through life and age. And so every year or two, it's good to have a booster treatment.
Got it.
Okay. So we'll get ready here. Okay, I'm just going to do a little treatment, and I'm going to do first a test line just to let you know how it feels, Sarah, okay? So what we'll do is we'll make sure we have nice coupling with the gel. And I'll look at the face here in the image, and that looks great. And I'm just going to pinch your cheek a little bit just to lift the tissue off. And we'll do a nice little treatment line. 1, 2, 3. How's that?
Fine.
It's not bad.
I mean, no, you don't. It's just a minimal tingling, but there's no pain with it right now.
You definitely, Julie, you definitely want to feel something because what we're doing is we're using Ultherapy to modify the wound healing response. So we want to create a little controlled wound and have the body repair itself, and so that's what really builds collagen. And so you should feel something, but it's definitely tolerable. You know, it doesn't have to be uncomfortable.
Like people aren't walking out of the office crying after this.
Not at all. Not at all.
Good.
Not at all. I cry sometimes. I get emotional, but it's good.
When people leaving.
That's right.
That's so funny.
You doing okay, Sarah?
I am, yes.
Okay. So we'll do several lines in this area. And again, we're focusing on the SMAS layer, that's the facelift layer. And by doing my little jump around technique here, it really helps to allow the heat to diffuse, and so Sarah isn't as uncomfortable with the treatment kind of thing.
Now, who would not be a good candidate for this? Like, what does this not work to treat?
Well, I think anybody who really, the best way to tell if you're a good candidate is to go in and have a consultation with a very good, well-educated provider kind of thing. I think anybody who doesn't have facial laxity, anyone who maybe has more extensive laxity or severe laxity that would do better with a facelift wouldn't be the best candidate. Now, I do see patients sometimes that are like, Dr. White, I'm never going to do a facelift, or maybe they might have some medical issues that prevent them from doing surgery. But there are some contraindications to treatment too. Anybody who has wound healing issues, such as diabetes or any collagen vascular disorders, anyone who's had some plating of the facial skeleton would be a good candidate. And there's a whole list, and you can kind of go through it. But it's always the best to go in and have a consultation.
Talk to a doctor.
Talk to a doctor. Yeah, that's the best thing.
That makes sense, for sure.
And we're going to go back here and treat another little area, moving backward. And we just pinch and squeeze. It's nice, the machine keeps track of every treatment and lets us know how many lines we're delivering. And usually this is a really nice lunchtime treatment. Treating the whole face and neck takes about an hour. Usually you can go right back to work right after the treatment. The engineers who developed Ultherapy were really brilliant in the fact that they're able to direct the energy beneath the skin surface, and so you don't really have any changes on the surface.
Right.
And so for that reason, it makes it an ideal lunchtime treatment. You can go in, get a treatment, go right back to work, or go on with your day.
That's good to know, because I know a lot of people don't want the downtime, they don't want to have to take off work. So this is a good option if you want skin tightening and don't want to, the week of recovery after a facelift.
Exactly.
Amazing. Well, we also actually are getting a ton of comments already in. Ellen wants to know if it can be done on the neck and where else you can do this treatment.
Oh, that's a great question, Ellen. I think one of the best areas that Ultherapy is really good for, and up till now we haven't had a good option other than surgery, is the neck. And so Ultherapy is really great with tightening the area just under the chin, we call the submental region. It's also great for defining the jawline. And what it works great on, if you've ever seen those horizontal lines on the neck.
Yes.
Yes, I've tried to treat
Crazy.
those before with Botox, and I'm just not, the best thing for those, I think, is Ultherapy. There's some great off-site treatments emerging. The décolleté is one of the ones that we get really great results with, and so patients really enjoy that. They have a nice event, they want to wear a nice dress, and so it's good to do a couple of months beforehand to get a really nice result, kind of thing.
It's good to know.
Yeah.
So we have a bunch of other people asking. So some commenters are worried that it'll give your face a gaunt look. Is this a concern that people should be worried about, or is that impossible to do with this?
You know, I think if you go to a well-educated practitioner that stays on the recommended treatment protocol and they have a nice experience with the treatment, it's very hard to have any gaunt effect or lose any fatty tissue kind of thing. We actually tried to develop this as a technique in order to ablate fat, and we abandoned it just because it was so hard kind of thing. The ultrasound energy, if you think about, there's different lasers, and sometimes those different lasers have a different wavelength, and so some lasers are great for red spots, some are great for brown spots. Ultherapy has that similar selectivity in that the energy really wants to be absorbed by the collagen. And so it's not very well absorbed in fat, so I don't think that you have to worry about that.
I think that's important to note as well for people who are watching right now, that it's not a fat melter. This will not, melt any fat. This is just skin tightening.
There are much better treatments on the market right now. Other treatments like cool sculpting, Kybella, even liposuction. There's a lot of other great treatments for that. And the thing about doing Ultherapy too is it's very easy to combine with other therapies, and so one of my favorite combinations is doing a little bit of lifting and also adding back volume, and so we can do fillers at the same time. We can also use, if patients have some wrinkles with smiling and facial activity, we can also do some neuromodulators like Botox or Xeomin or any of those different things, and so that combination treatments really help well, and I do them a lot.
That's amazing. And now, is there an ideal age that people should get this treatment?
The most common age that I see is probably patients in their late 30s, early 40s, even to late 40s kind of thing. But I think one of the growing areas of my practice is that we're seeing patients who really don't have any signs of aging yet. Somebody like you, Julie, or you, really. People that just want to do a preventative treatment. And we have this nice treatment and we practice, we call the C-Boost. And so we'll do a lighter treatment just to boost a little bit of collagen. It's not necessarily to tighten specifically, but just to build a little collagen. And so more and more consumers and patients that are very well educated are realizing how beneficial this can be, and so we're coming in with that. And I think the other area that we really haven't talked about that sometimes I see the best results in, and you might not have thought about this, Julie, is patients that have previously had a surgical facelift. And so if patients get to the point where they feel like surgery is their best option, when we do a surgical facelift, what we're essentially modifying is the architecture of the face. We're not doing anything with the biology. And so to maintain your results a few years after the facelift, you can do an Ultherapy treatment, and that actually builds collagen. It stimulates turnover of the face, and so it's like a tune-up. And so it's great. And so
that's good to know also.
So we get really great results with post-surgical patients as well. Even patients that have had a facelift before and maybe they don't like the results, another option if they don't want to go through surgery again is to do Ultherapy. So, how you doing, Sarah?
I'm doing good.
Okay, great. We're going to do a few more lines, and then we'll switch over. I'm going to add a little bit more ultrasound gel, You in any discomfort?
So you do feel a little bit more, I would say, of the tingling the
Yes.
more you do the treatments. Like later on, you do feel a little bit more of the intensity.
Yes.
But it's just slightly discomforting. Like it's not painful. I would say like a little spicy, as we were talking about earlier. Like that's kind of how I would describe it, but not at all painful.
Good, good, awesome.
And now, is this available across the country?
It is, even around the world.
Wow.
Yeah, I've had the opportunity to speak in a lot of countries in Asia, Middle East. It's South America. It's available all over the world, and so one of the nice things about Ultherapy is it's completely colorblind. And so patients of any skin tone or texture, sometimes patients with darker skin type, for example, you have to be careful with lasers because it can affect the pigment in their skin. But with Ultherapy, any skin type is fine. So that's great. Yeah. So that's why it's I think one of the reasons it's been accepted all over the world.
And now a lot of people are asking about how much this generally costs. Like I know it may differ depending on where you are or who you go to, but in general, it's like the price range.
Yeah. So it is relatively new technology, and anytime something comes on the market, we pay for the development of it a little bit, if you will. But anywhere from a couple of thousand on up, kind of thing. And if patients are price conscious, I necessarily wouldn't go to a cheaper, more inexperienced provider, or maybe buy it as a deal. But what they can do, and is a really nice option with Ultherapy, is just treat a small area. For example, you can just treat the neck, you can just treat above the eyebrows, you can just treat around the eyes. And so if your budget really is not really ready for a full face treatment, you can just try a small area and sort of see how you do. And if things go well, you get a nice result, you like it, then you can move on and do more treatments.
That's good to know.
Yeah.
What's the most common area to treat?
I think the neck. The neck.
Okay.
For the sole treatments, but by and large, I think to better answer your question, patients most commonly ask for a full face treatment. They just want everything to be in harmony. Yeah. So, all right, great. I'm going to switch over. So we've done the deeper layer now, and I'm just going to switch over to do the skin. So we have another transducer, the 7 3.0. I'll have you guys take a look at that. That's really great for treating the superficial skin. And so when we do Ultherapy, you get really a dual layer treatment. You can lift the lower connective tissue and also tighten the skin a little bit. And so that really helps the results.
And now, when you're looking for a doctor, what kind of qualifications should you look for?
So I think anytime you want to look for a cosmetic provider, always the core specialties are the best. Dermatology, facial plastic surgery, plastic surgery, oculoplastic surgery. Some of the oral maxillofacial surgeons are trained, and I think that's always good to start there. We do have providers in other specialties that focus only on cosmetics, but I think the best question to ask is, what has your training been for this device? And secondly, how many of these treatments do you perform? If it's somebody that only does it occasionally, or it's new to their practice, maybe it makes sense for you to go somewhere else. It never hurts to get 2 and 3 opinions before you sign up for a treatment too. And also ask your friends. I mean, this treatment is so popular. I think a lot of people would be surprised how many of their friends have already had it.
Done it,
and so you can maybe ask your girlfriends or some of your buddies, and we're seeing a lot of men do it now, especially for the neck. And so, you can ask around with your friends and see what kind of experience they had too. Yeah. All right, so we're going to get the treatment ready here. So with this more superficial transducer, we're treating the skin, and so we lay down more dots, so you'll hear more beeps, but usually this is a lot better tolerated, Sarah, a lot less pain. Okay? 1, 2, 3. How's that?
Good, yeah, just like a little pinpricks.
Yeah.
I guess it would say it feel like.
Exactly. And you definitely are feeling it, which is good. And so we have the energy level turned up to the right setting, and you're doing great. And again, I just jump around a little bit. I think it allows the heat to diffuse.
That does help because you can feel like once you kind of get to that point, then you bring it to a different location where it doesn't hurt.
Exactly. Good. And you can really get the jowls in this area too and really help tighten up that area.
Let's tighten that up.
And again, for those of you who are just tuning in, we're here with Dr. White, and he is doing an Ultherapy session right now with our wonderful model, Sarah. It's a skin tightening treatment that should be done once or twice
Once a year.
every 2 years.
Once every 2 years
Okay.
is good.
And the results last pretty well. He said it builds collagen, and that naturally will eventually go away with age, which is why this is such a good treatment.
Exactly. Collagen stays around forever, but we continue to age.
Now, could somebody get burnt from this treatment if they were not seeing a good provider or it was not properly administered?
Yeah, you know what? It's a powerful device, and so anytime you have a powerful device, you really want to give it appropriate due respect, do the right education, really learn it, do a lot of treatments under your hands, and so you can have adverse effects for it.
Okay.
There can be skin changes with it. The most common things that happen after a treatment, and what I hear a lot of my patients is mild symptoms of inflammation. And so, after you've had any inflammation, you have some warmth in the area. You might forget about it and be watching a movie and put your hand here and that's a little tender. But that's good. That means that the collagen machine-making enzymes are working, and so that's what we want. And so that usually lasts for a couple of weeks. Okay. But that goes away with time. There's a risk of some nerve weakness in the smiling muscle that's transitory, and it goes away with time. I've never had that happen, but in general, it's a very safe treatment.
Okay.
And it's a very easy treatment to learn. I think Ulthera and MERS as a company have put a lot of thought into it, really making it physician-proof, really making it simple for us to use with a nice touch screen, and they have a lot of education programs, so it's great.
That's good.
Yeah.
And Sarah, how does this treatment feel compared to the deeper layer one?
So it definitely, you can tell it's not going as deep into the skin. You can feel a little bit more superficial. When you were doing the first version, the first pass that was a little bit deeper, I can almost feel like in my teeth a little bit. It seemed like the vibration in my teeth. Where this, again, is just like little, like pinpricks, I would say, it feels like.
Okay.
And so I did, in disclosure, take some ibuprofen about an hour before the treatment.
And I
just
think
to kind of, maybe take a little bit of the edge off.
that's great.
And that's all I've done.
That's good to do. That's helpful for patients to do. Patients ask frequently, do you sedate me or do you give me pain medicines? And I don't feel a need to do that at all. So I feel like a little ibuprofen right before the treatment is great and really helpful.
What about topical numbing creams? Do you ever use those?
Because this treatment's going really deep, the depth of the numbing is really not ideal kind of thing.
Okay.
If patients really has a lot of discomfort, sometimes we can inject numbing medicine, but it's extremely rare that I ever have to do it. It's not necessary.
And I would say if anyone has tried this in the past, like at the very beginning when the technology first came out, it was a totally different experience. Like that was painful for me, where this is mildly uncomfortable overall.
Right.
A lot of that's in the wrist, though. Yeah.
It's all about,
Go to a good provider.
That's
all about the provider.
Yeah.
That's probably true for a lot of procedures, though, and treatments. You really have to do your research about who you're going to.
Yeah.
It makes all the difference.
The great thing about Ultherapy is that there's so many good doctors in New York City, and I know probably people are watching this all over the country, I would imagine, but it's really easy to find a good provider. What you can do also is you can go to the Ultherapy website, and you can actually enter your zip code and look for a provider around there. You can ask pointing questions like, what's the provider's training, how long have they had the machine, who does the treatments, questions like that. Yeah.
Makes it much easier.
Yeah. Excellent. Yeah.
And then once again, can you just repeat what areas of the face this is used for? Just for people tuning in right now.
So patients that come into my office most often will select what we call a full face treatment. So we'll do a treatment in the neck first, and that's great for the submental area. Sarah has no signs of aging there, unfortunately.
You're just being kind.
but it helps to define the jawline, and also any horizontal lines in the neck skin it's really helpful for. We'll do the face treatment, which helps jowling and also lifting of the cheeks a little bit. If you need volume, we can also combine it with filler treatment as well too. We'll do around the eyes and also in the brow area and the forehead if you want to lift the eyebrows. That too can be combined with filler and also neuromodulators like Botox and Xeomin to help any wrinkles with activity kind of thing. We don't treat the eye itself inside the eye socket, and so, but anywhere outside of that.
Okay.
Yeah.
Ellen wants to know, are there secondary benefits like improving red spots or acne scars when you use this?
You know, the Ultherapy device is still being studied for scar improvement, and so we're waiting to see that research. Again, as I said, this is a nice modality that you can combine with other treatments, and so if you want to lift a little bit with Ultherapy, a nice other combination treatment is a laser. Lasers are still great, and they're particularly great for brown spots or red spots on the surface of the skin, or even fine lines or wrinkles or little cracks that we have really on the skin surface. And so combination treatments work really well, but for brown and red spots, Ellen, the best thing typically is a laser. Got it.
And now last question, how common do people come into your office for this, and would you recommend it over a facelift?
We do several treatments a week, and so every day we see patients that want Ultherapy. It's a very popular treatment. In terms of the non-invasive treatments that we have, right now it's the best thing that we have for lifting the face. And so we use it a lot. I always offer my patients that come in, and sometimes patients are, Dr. White, should I do a facelift? Should I just do Ultherapy? What am I ready for? And my advice to them is, if you're still on the fence, you don't burn any bridges by doing Ultherapy.
Right.
If you decide to do a facelift 3 months later, 3 years later, you can still do that. You don't burn any bridges, and you're going to get the building of collagen effect with Ultherapy. And so it doesn't hurt.
Amazing.
Yeah.
Well, thank you so much.
Thank you.
And guys, again, if you were just tuning in, we're here with Dr. White, and we just did Ultherapy on our amazing patient here. It was skin tightening treatment, and you can ask any questions you want down in the comment bar, and we will answer them afterwards. Thanks, guys.